All right, let's dive in and talk about our digestive system. It's this incredibly complex world inside us, and it's sending us signals all the time. Today, we're going to learn how to decode those signals, those gut feelings, to get a much better handle on our own health.
I mean, we've all been there, right? That burning feeling creeping up your chest after dinner, or that stomach pain that just feels different. These aren't just random annoyances, they're messages. And sometimes they're pointing to something much bigger. So, what exactly is our body trying to tell us?
So, let's start at the top of the system with one of the most common troublemakers, stomach acid. Now, we need it for digestion, no doubt, but when it starts going where it shouldn't, well, that's when you run into some pretty serious problems, like GERD and peptic ulcers. Okay, so picture the little valve between your esophagus and your stomach. It's supposed to be a one-way door, right? Food goes down, stays down. But with GERD, that door is faulty. It doesn't seal properly, so that powerful, corrosive stomach acid splashes back up into the esophagus. And we're not talking about a little heartburn once in a blue moon. This is a chronic condition, and over time, that acid can do some real damage. And this is where it gets really interesting, because the damage isn't always what you'd expect. All that acid can actually scar the esophagus, making it physically hard to swallow. It can cause tiny, slow bleeds that lead to anemia. The acid can even get into your lungs and cause pneumonia. But the big one, the one doctors really worry about, is that it can literally change the cells in your esophagus, creating a precancerous condition called Barrett's esophagus. So moving on to ulcers, here's a fascinating clue doctors use. It all comes down to timing. If the pain gets worse right after you eat, that points to a gastric ulcer, a sore in the stomach lining itself. But what if eating actually makes you feel better for a little while, only for the pain to come roaring back a few hours later? That's a classic sign of a duodenal ulcer, right in the first part of your small intestine. It's a simple little detail, but it's a huge clue for diagnosis. Okay, so we've covered the chemical problem of acid. Now we're going to shift gears to a biological one, inflammation. This is the world of inflammatory bowel disease, or IBD, which is basically when your own immune system declares war on your digestive tract. First up, we have Crohn's disease. The thing to remember about Crohn's is that it's the wild card. It can show up anywhere along the GI tract, literally from your mouth to the other end. And it's deep. The inflammation bores right through all the layers of the bowel wall. It also shows up in these disconnected patches, what they call skip lesions, where you have a really inflamed spot right next to a totally healthy one. Now, on the flip side, there's ulcerative colitis, or UC. And unlike Crohn's, UC is way more predictable. For one, it's confined to the colon and rectum. That's it. And it always starts in the rectum and just spreads upward in one continuous, unbroken stretch of inflammation. Plus, it's superficial, only affecting the inner lining. This chart just lays it all out so clearly. Location, everywhere for Crohn's, just the colon for UC. The pattern, patchy versus continuous. The depth, full thickness versus superficial. And these differences are absolutely critical. They might feel similar at first, but knowing which one it is completely changes the entire game plan for treatment. All right, let's turn our attention to one of the unsung heroes of the body, the liver. I mean, think of it as this massive, tireless factory working 24/7. But just like any factory, it has its limits. And when you push it too hard for too long, the whole system can start to fail. It does so much. It filters out toxins. It processes all the nutrients from our food. It makes vital proteins. And it does it all silently, without any complaints. That's the problem, you see. By the time your liver actually starts to show signs of trouble, the damage can already be pretty severe. You can see this tragic progression really clearly when we look at alcoholic liver disease. It starts with a fatty liver. It's often silent, no symptoms, and, this is key, it's totally reversible if you stop the damage. But if you don't, it can progress to hepatitis, which is inflammation. Some of this can still be reversed. But then you hit the final stage, cirrhosis. This is when healthy liver tissue is replaced by permanent scar tissue, and there's no going back from that. And just how bad is that final stage? Look at this number, 45%. That is the 1-year survival rate for somebody with the most severe class of cirrhosis. That's less than a coin flip's chance of surviving for a year. It's a really stark reminder of why it's so important to catch liver damage before it ever gets to this point. Okay, so we've looked at acid, we've looked at inflammation, we've looked at organ failure. They all sound so different, don't they? But the fascinating thing is that our bodies often use the same universal language to scream for help when something is seriously wrong. Let's wrap up by learning to decode those critical signals. So with all the different aches and pains we can get, what are the real alarms? What are the signals that cut through the noise and tell you, hey, stop guessing, go see a doctor? It doesn't matter what you think the cause is. These are the ones that matter. This is the list. This is what you absolutely have to remember. If you're losing weight and you're not trying to, if it's getting harder and harder to swallow food, if you're vomiting and it just won't stop, or if you see any sign of bleeding, these are not negotiable. These are your body's version of a fire alarm. You don't ignore them, you get help. So, in the end, it really all comes down to this. Our bodies are talking to us all the time. The goal isn't to diagnose yourself, but to become a better listener, to really hear those signals, so you know for sure when it's time to ask for help. Thanks for tuning in.